looks crazy. Let's make my hair look not so crazy. In the office today, and the office is kind of a mess. Like my hair. You guys take me seriously with my hair today? Because I cannot. So, my name is Allie, and I'm a hospice nurse. I've been doing hospice for like almost 5 years now. So today, I've seen a bunch of videos on the YouTube of nurses doing like nurse kind of life hacks, and I wanted to try a few of them. And I also gathered like my favorite ones to just kind of tell you guys about. Water, get out of my shot. Rude. Some of them I'm just gonna kind of read out. That's how we'll go about it. We're kind of just gonna wing it. So let's get started. The first one, oh, I wanted to know, have any of you guys done this? Powder a bedpan before putting your patient on it. I mean, I don't do too many bedpans in hospice. I just haven't run into them. Crinkly, my scrub top is. But I guess the concept is so your patient doesn't stick to it. Very helpful, I think, for our larger patients. Sometimes it's plastic and things get hot down there, depending on how long they're on it for too. I think that'd be super helpful. Yeah, so let me know if any of you ever tried the powdering a bedpan thing. So the second thing that I want to try is, I've seen this a couple of times. You use syringes to disintegrate a pill or to dissolve it. And in hospice, we use this syringe. So this is like a 1 ml. It's super small. I don't know if it's going to have the vacuum enough to actually dissolve it. I'll try both because this would make it super easy to do slurries. Because usually we get Ativan tabs, right? So this would be easier than just crushing it and having to then draw it back up. And you kind of feel really wrong crushing like Ativan and meds and stuff and slurring them and mixing them around in a cup. My water, I'm going to use just like a baby, not a baby aspirin, but a Bayer. And I'm going to try to kind of cut it up into the size of an Ativan. See how big of a pill I can fit in here. Go in. Yeah, I don't want to be doing that in front of a family, forcing a pill inside of a thing. Yeah. Now, which half is as big as an Ativan? Oh, and terra coating. Hello. Like, I don't know if I'd be able to actually fit an Ativan in here. What I've seen is they put the pill in there, and they draw water up into the syringe, and apparently it's supposed to melt it. Oh, it did it. You guys see that? Stop focusing on me. It actually did it. Whoa. Oh, that's a game changer. Holy guacamole. Really hope an Ativan fits in there. But it does seem like it takes a little bit of time. Can I shake it? I know Ativan dissolves fast. The Bayer's kind of like, it's like a little science project in there. Let's try the bigger syringe. And this one is a 10 ml syringe. Don't use these a lot. I'll try a bigger half of the Bayer. What it looks like when I pull it up. Ready? Focus on the syringe, girl. Cap it. Cap it. And then I think you're supposed to pull back on it. Whoa, you see that? Pull back. And look at it, it just breaks apart the tab. Are you kidding me? I'm going to use this life hack for sure. Pro tip though for slurries is don't make them ahead of time, too far ahead of time. I just teach patients, families how to do the slurry. Because if you make them too far ahead of time, they actually do what the Bayer's doing and then they separate and you might not actually get a lot of that med in there. What happens if I pour it out? Hopefully nobody drinks this water. Yeah, not all of it came out when I tried to do that. Boop. What happens if you shake it up and then do it? Shake it up. Shake. Okay. Ready? Boop. Oh, it bedobbled me. Oh, that worked. You gotta just shake it up and push it. So life hack number 3. Let's talk about our lovely families. We all love them. We do. And especially the ones who want to be involved, but they really don't know how. At end of life, it is harder to, for some family members to figure out how to help and cope. One way that I learned how to involve family members is I try to involve them in just simple care. Whether that be doing mouth care, or they can wash face, clean the ears, paint nails, things like that. And try to involve them in some way. That way, they're not just hovering over you asking a million questions. They actually feel like they're doing something. other than asking you a million questions, but they'll probably still ask them anyway. But that's kind of like my nurse life hack. Involve them in the patient's care, just because I think it's good for them and it distracts them and it kind of makes them feel like they're a part of what's going on and not just kind of on the outside looking in. So number 4. So I know a lot of us nurses and CNAs, PCAs, medics, whatever you are, sometimes we will write vital signs down on a glove or on an alcohol pad, and then we accidentally throw it all away. So I kind of found a cool life hack, and I don't know why I didn't think of this before. Don't some of us, we use our hands too? And then we come out looking like we have like bad prison tattoos. I know nowadays most of us probably aren't writing things on our hands. So I got an idea. What did I do with the tape? Not my favorite. Okay. Oh. I'm just gonna tape up your dressing. Just give me one sec. The life hack is, instead of using a glove or like a wrapper of an alcohol pad or whatever you do, put on some good old 2-incher medical tape here and write down your vitals. My arm's squishy. I should work out more. I guess maybe, oh, if you have arm hair, this might not work. Maybe try the forearm. A pen? Maybe it's the pen. I'll try Sharpie. Okay, cool. I mean, yeah, it works. Are you going to throw it out though? Probably not. I've also seen those like nursing, those whiteboards, like the little mini ones that you clip, and I'm just like, those are going to get smudged off by my scrubs, and then I'm going to end up with dry erase marker all over my scrubs. This might be a good thing for home health and hospice going to COVID homes, because you could always put on your isolation gown or something like that, or somewhere, like wherever, instead of bringing your entire notebook in, or because we aren't bringing our laptops in or anything like that. If it's a like a COVID home, this might be a good idea, so you can write things down. Oh, I would run out of space eventually. Maybe you use like better paper tape though. Tape to the arm. 5. So I am a glasses wearing nurse. Many of us are. And nowadays we don't really have too much of an issue with our glasses sliding down our faces because we have masks on all the time to help prevent it. If you're not wearing a mask, or if you're wearing a mask and your glasses still slide down, I found a cool life hack, and I don't know why I didn't think of this, but put skin prep on the bridge of your nose, right? And your glasses won't slide down. Because when you're at work, the last thing you want to be doing is touching your face and going like this all the time with your wrist and touching your glasses. Don't touch anything on your face. It's such a cool life hack. Some of the stupid ones that I found are, this one is dumb. Wear an isolation gown over your uniform if eating a messy lunch to keep your scrubs clean. Doing that. We can't now because we wouldn't waste them, but I wouldn't waste I let the scrubs take a hit. I'm not going to be wasting company stuff so I can eat my messy ass lunch. Use a paper towel, or just like eat over a table or something. Where am I? Number 6? But the next one I'm going to let all of the nurses know, because especially home health and hospice, because we don't work in a hospital. We don't have access to scrubs. Like, we can't just run down to the OR and be like, hey, my scrubs got soiled. Can I borrow some? Keep extra scrubs in your car. Keep extra sweatshirts in your car now, because you don't know what's going to happen. You don't know what's going to happen in our COVID homes. And if you have nothing else to change into, you are stuck like that for 8 hours of the day or more, which is not cool. Not cool, man. Those are my life hacks, or my nursing life hacks, not my personal ones. No. But I have to say, I really do like this one. I am interested to know if any hospice nurses have ever tried slurrying an Ativan using that technique. That would be interesting to find out. Almost poked myself in the eye. So I hope you guys enjoyed a little bit. I know it's like a super short video. So those are the ones that I found interesting. Some of them are kind of stupid. So those are the ones that I really, really liked actually, and that I really wanted to try. I do like the idea of using the tape to write stuff down on your arm instead of using like random things that you find around you. You might end up throwing away, which we all know, hands up if you've ever done that. I hope you guys get to try some of these out in the field. I think the tape one is ingenious. I think this one is ingenious. If you guys would like and subscribe, that would be awesome. It helps me out a ton. I'm trying to reach my goal of 1,000 subscribers. I'm closer than I ever thought I would be, and I appreciate all of y'all. All y'all? All of y'all? All y'all. I'm not from the South. Clearly, I'm not from the South. I appreciate everybody who's liked any of my videos and who follows me and who supports what I'm kind of doing, and I really appreciate it. I know not all of my videos are about nursing stuff. That's okay, because I do have a life other than nursing. Clearly, because I haven't even ironed this. Reasons why I kind of like Metalita. I don't have to iron them. Just saying. I gotta go do laundry. Again, that life outside of nursing. Like to leave any comments below. Questions, comments, concerns. Or if you have any like life hacks of your own that you've ever tried, let me know. I would definitely love to see if any of those are super helpful. Cool pen. I actually used to hand these pens out to nurses when I went to different facilities like assisted livings or SNFs. Oh, no, don't go anywhere yet. I'm not done telling my story. Because sometimes they would be having really hard days. And I think they deserve to know that they're doing a great job. They're trying their best with what they got. So I appreciate all of them and what they do. I did run out of pens though, except for this one. I found this one somewhere. Sally, I hope you really appreciate this video. No, don't appreciate it. Thank you for watching. I appreciate you watching. That's it. I'll get the hang of it one day. Bye guys. Bye guys.